afternoon, everyone. Welcome to a beautiful Saturday on Safe Space with Pastor Wale. I am your hostess for today. My name is Udrak Afelumo. And today's topic is really interesting and one that touches home. On the last episode, we had a conversation on men's health, but today we're zoning in on women. And this is because October has been considered to be a breast cancer awareness month. It is the pink month. And so our topic today is a touch of pink, the breast cancer awareness. Now, to help me do justice to this topic on cancers, especially breast cancer, is a consultant anatomic pathologist. Her name is Dr. Emma Omobong. She works in one of the, let's just say, leading government hospitals right here in Abuja. And she is going to take us through the issues of cancer, breast cancer, and other cancers that affect women. So please join me to welcome her. And while we're doing that, just before we do that, if you haven't subscribed to this space, if you haven't subscribed to Safe Space, please do so. Just hit that subscribe button right there and share, because at the end of, we have something good is coming, but you will get to hear about it at the end of the program. So please share with your sisters, share it with your friends, share it with husbands, brothers, women, everyone. Everyone needs to be aware of what we're going to talk about today. So without further ado, please welcome my guest today, Dr. Emma Umobong.
Thank you. Good afternoon and welcome to Safe Space. I'm glad to be here.
Yeah, we're glad to have you. So, Dr. Emma, who is an anatomic pathologist? I have been calling you very carefully so that I don't twist my mouth too much. So, can you tell us what you do? Tell us more about you.
Anatomy pathology is a medical specialty that deals with abnormalities in the organs, could be the whole organs or tissues, using the gross microscopy, looking at the organ, and then the microscopic aspect of it to arrive at a diagnosis.
Okay.
So basically, we are the unseen doctors behind other specialties.
Okay.
And almost all the specialties need anatomic pathologists for the final diagnosis.
Okay.
So first of all, an anatomic pathologist is first of all a doctor, a medical doctor,
Yes.
and then specializes in pathology, anatomy pathology to be precise.
Okay.
So it's a specialty that collates both microscopic, and then some other specialized tests with clinical data, and arrives at a diagnosis and sends the report to the surgeon or the requesting physician.
Okay.
There's a saying that goes that if the anatomy pathologist doesn't say it is cancer, then it is not cancer. And as such, an oncologist will not take up a patient if he doesn't have a report from the pathologist.
Okay.
So that is basically what we do. And there are three divisions. We have the surgical pathology, those ones, the tissues that are removed from the body. Every organ or tissue that is removed from the body is supposed to be sent for histology.
Okay.
That's the only time that you are sure of what you have.
All these terms, you will break it down for some of us.
Okay,
so.
Histology is, when you look at the microscope,
Yes.
when the tissue is removed,
Yeah.
it undergoes a lot of process, and the end result is the microscope, which the anatomy pathologist will now look at and say, okay, this is cancer, this is inflammation, or whatever the diagnosis is.
Okay.
So surgical pathology deals with that. We have the cytopathology. Cytopathology is the scrapings from the tissue. Now, they're not taking the whole tissue. It's like the
Yes.
pap smear. When you
Yes.
take a pap smear,
Yeah.
that's cytopathology, or some of the fluid, or use a needle, fine needle aspiration to take some samples from the
Okay.
body. So
Okay.
that's cytopathology. Also, it's going to be subjected, looked at under the microscope.
Okay.
And then we have the autopsy pathology.
Okay. That's the part Africans don't like. We don't like autopsy.
No, but it's there. It's something that we can't run away from.
Yeah.
Though the rate is declining in Nigeria. So long and short, that is what anatomic pathology is all about.
Okay. Okay. So basically, you guys are the ones that just make sure
Give the
you
final
clarify.
diagnosis.
Yes, it's like the final thing. It is either this or that.
Or
So,
that, yes.
I mean, if you have been to a doctor and you heard her talk about the swelling, the aspiration, that caught my attention, because some people just go, you see them with saying, oh, my doctor said, and you're wondering, have you done any tests? Your doctor can say, but maybe now we know that there's a pathologist and an anatomical pathologist. We can also ask our doctors to, please, have you tested, have you sent it to them? Have they said what it is?
Exactly.
Have they confirmed what you have said? So we're honored to have you. We're
Thank you.
glad to have you. So what is a cancer? You even in describing what you do, what is a cancer? What's cancer?
Cancer is a general term for lots of diseases that affect any part of the body.
Wow. Any part of the body?
It can affect any part of the body.
Okay.
And it's when cells grow out of proportion, out of boundaries. God created us in such a way that it gets to a point, we have growing cells, a child that is born, the cells are growing. It gets to a point, the height stops.
Yeah.
All the other adolescents, cells are supposed to stop at some point.
Yeah.
Other cells, like the skin, will continue to divide.
Yeah.
Others will stop permanently.
Yeah.
Like your brain cells, once it has finished development, it stops. Other cells will stop, but when the condition arises, it will start proliferating again, dividing again, like the liver cells. But cancer cells, they don't stop. They just continue to grow.
Wow.
They grow out of proportion. They grow out of their boundaries. They get out of where they're supposed to, their enclave. And then some of them may now affect other organs and then enter the blood vessels and go to far organs. Like you can have cancer of the breast. Before you know it has affected the bone, it has affected the liver. That is metastasis.
Yeah.
So this is what cancer is all about. And it's also a genetic disorder because it involves the genes.
Okay.
It involves the gene. So when the gene changes, there's a change in that gene. It causes the cancer cells to now proliferate, to start growing out of order.
Okay. Can you, when you mentioned genetics now, because when some of us hear genes, we're thinking, okay, genes is genetic, what my mother passed to me, what I collected from my father, so
Yes.
can you clarify that a bit more? And because I was actually going to ask you what factors predispose to cancer, to just these things, just cells just growing out of proportion.
Genes are what actually control cells, to grow, divide, and stop. And they are passed from the parents. You get some genes from your father, some from the mother. So when these genes change, there's lots of factors that can cause these genes to change. Once they change, they no longer do the function that they're supposed to.
Okay.
So that is when all these issues start arising, and they may lead to cancer and some other illnesses.
Okay.
So that way, if it changes in the mother passes it can pass it on to the children. So the children would now have it. Like breast cancer, in Nigeria, it's been known that the highest risk factor is genetic, family history. If you have a family history of breast cancer, first generation, the mother has breast cancer, it's likely to pass to the daughters. It's not it's not a fast this thing, but one daughter may get that mutated gene that has been passed.
Okay. So one somebody that, if a family member has had breast cancer or any cancer,
Any
cancer before, you should be on the lookout.
on the lookout.
On the
Exactly.
lookout, Okay, so what other factors can predispose to cancers generally? I mean, we're zoning in on breast cancer today. We're zoning in on breast cancer today, but really, I'm like, is it more, does race have to do, because some other diseases you'll say, okay, it's more in white people than in the black people, it's more with young people than with older people, so it's more in men than in women. Where we hear breast cancer, everybody thinks, I mean, there are certain cancers we hear, we know it's women, so today we're about women, we want to go into the women, but what other factors,
Okay.
predispose to people's cancers?
Like in the first place, there's been a rise in the incidence of cancer worldwide.
Why is
And
that?
the cancer does not really have a cause, but it has conditions, predisposing factors that can make one to develop cancer when you are exposed to them. Now, not everybody that's exposed to those factors that may develop cancer. Some of these factors are fixed, that you have no control over it. Others you can control. The fixed one is the age. Cancer is common or more common with the elderly. So as you grow older, the likelihood of your developing cancer, one form of cancer or the other, is higher than a younger person. Sex. Some cancers are for the female, then others for the male. Depending on your, the reproductive organs. If you're a woman, you have the cervix, you have the ovaries, the fallopian tubes. Like I say, cancer can affect any part of the body. So you can't change that. Breast, yes, breast cancer affects the men too, because the men have breasts. Yes, it affects men, but the incidence is lower. Lower. Then family history, you can't change. You can't change that. Then others that you can change: habits, unhealthy eating habits. I think one of the greatest factors that has affected Nigeria is a change of dietary habits. We no longer eat our vegetables, our fruits. We are now into fast food, processed food, canned food, the saturated fats, which has changed the system. Those things, fruits and vegetables, they are really quite good and quite healthy. So that is one. Tobacco, cigarettes, now they call it shisha. It's a very high predisposing factor for almost all the cancers.
Wow.
Some tobacco byproducts have actually been aspirated from cervical mucus.
Wow.
So it causes cancer of the cervix too.
Wow.
So it involves
speak to your audience,
it involves practically all the cancers.
Wow.
Cancers. Then you have things like sedentary lifestyle, lack of exercise. It adds to it. Exposure to radiation, ultraviolet, sunlight. If you are unnecessarily overexposed to sunlight, especially the albinos, develop skin cancers.
Wow.
Then some drugs, viruses, infections. Some viruses and bacteria also cause some cancers. Like the HIV has some defining cancers. Cancer of the cervix, hepatitis B virus, cancer of the liver, human papilloma virus, cancer of the cervix. So that's associated with that. And what else? There's so many. Wow. This is the general category of the predisposing factors for cancer.
Wow, wow. I hope you're listening, and if you've been with us from the beginning, there's already so much. I feel like like I could take notes while she's talking. So if you haven't shared this, please share. Please share. Put it on your Facebook. Put it on your share the YouTube link. You can put it on your WhatsApp status. Let somebody just join in. There's still so much more she's going to talk to us about, and it would really, for me, you are saving a life. You are saving a life. So if you haven't yet subscribed to this channel, please do so. Please do so. So Dr. Mobong, can we now zero in? You have said that as women, we can't change the fact we all have cervix, we all have fallopian tubes, we have ovaries, and of course, like our topic for today, the breast. And so, what what is most common in is now the awareness we want to do with breast cancer, is it because it's more common than the other cancers? I just thought to ask that.
Yes, the highest cancer incidence in Nigeria for women is breast. Is the breast cancer. It's really very high. In my practice, if I receive 10 breast samples, one must be cancer.
Wow.
And the age of incidence has really reduced in Nigeria. The youngest I've seen that I've diagnosed was a 13-year-old girl. A 13-year-old girl that, in fact, her own was so bad when it was discovered because she's, well, I don't know where she is now, a Muslim, swearing,
She was covered.
she was covered and living with an uncle. So it was when the mother went to visit her that she noticed, stain on the covering over the breast and told her to remove it. And then she now saw an ulcer. They took her to the hospital, they did a biopsy, and it turned out to be cancer, malignant.
At the age of 13?
13, yeah. She was just in JS1, age of 13. So it is that low in Nigeria. So breast cancer, cervical cancer comes next. Then cancer of the rectum, colorectal cancer.
In women?
Yeah, both men and women, it's common. In fact, cancer generally, bladder tumor, ovarian, those are the things that I see frequently in my practice.
Wow. Wow. Okay, so can we narrow it down to breast cancer now? What is can you tell us more about breast cancer? What does it affect? What's really going on there before we talk about what can be done about them? I want to understand what breast cancer, what it's about.
Okay, let me talk about the predisposing factors for breast cancer.
Breast cancer, yes.
Apart from the age, I've already mentioned the family history,
Yes.
mutation of the BRCA1 and 2 gene. Those are the part of the genes that are affected, that the mother passes to the daughter.
Okay.
And then we also have things like first, women that haven't had children have a higher tendency of developing breast cancer. So there's a saying that breast cancer is for the nuns because they don't have children, while cervical cancer is for the people with multiple sexual partners. Cervical cancer is for the commercial sex workers.
Okay,
so that's
now.
the saying.
Okay.
So that, then having children at late age, above 30, predisposes. But then breastfeeding reduces.
Oh.
Pregnancy reduces, because it said it reduces the period of time that the woman menstruates, has her menstrual flow.
Okay.
The period. Early menstruation and late menopause, that is, if a child starts menstruating before age 12, which we are seeing now, precocious puberty, we are seeing children menstruating at 9, and then some women up to 55 are still menstruating, also affects it.
They're predisposed to it.
To it, yes. Obesity. People that are obese, especially after menopause, because the fatty tissue releases some hormones, estrogens, that predisposes them to developing cancer.
Okay.
And then having cancer in one breast, the tendency of developing the other breast is high. And then having, it's not every breast mass that is cancer, malignant. Some are benign. But some of those benign cases can undergo malignant changes.
Wow.
Can change to cancer with time, depending on what it is. So that's why every tissue that is removed, don't just say this is a fibroadenoma and throw it into the dustbin. How do you know it? Unless the pathologist says this is what it is. It is not what you think that it is. Has to be has to be sent for histological analysis.
So, is breast cancer a death sentence?
It is not a death sentence if diagnosed early. Cancers generally are not. Yes, I know that there are some cancers that have a fast progression. Others take longer to progress, to metastasize to other systems. But the gold rule is early diagnosis. If it's diagnosed early, it can be treated. That is when it has not invaded. If it's just in a small duct or lobules, stage 1, the prognosis is high. I've had people that have lived with breast cancer for over 10 years, discharged, and are still alive today. So it is not, I know women panic when they say they have cancer, but there's no need to panic. It is not a death sentence. It can be treated. The facilities are there, even though it's a bit expensive. So that's why you have to prevent it. Prevention is better than cure. Okay. It's better to spend a little money and prevent it than to spend millions to cure.
So how do we go about preventing it?
Prevention.
How do we go about checking it?
I've talked about the risk factors.
Yes.
So apart from the fixed ones that you can't change, the ones that you can change, let's start with that. Let's go back to our diets. Vegetables, fruits, home-cooked food, not microwave. This is the microwave generation. Everything fast. Let's do it the normal way. Try as much as possible to eat organic food. Organic foods are better. That's one. Maintain your weight. Reduce your weight. That is, control what you eat. Exercise. It's advised that you do at least 30 minutes brisk walk every day, or at least 5 days in a week. That goes a long way to help. Okay. So you reduce all those controlled risk. And then there are other things that you can do. You examine yourself. Breast is external. It's not an internal organ like the ovary that you cannot see. Your breast you can see. So you need to know. Some women don't even know what their breasts look like.
Dr. Mobon, I think this one you will need to face the audience, because we need to understand. This part sounds like we need to pay attention. So let's
you need to familiarize yourself with your breast. Not everybody, the breast sizes of the two breasts are not the same in some people. The left might be bigger than the right. It's normal. So you have to know the normal to be able to know the abnormal.
Absolutely.
So you need to look at it. And that is where self-breast examination comes in. And there are in 2 stages. You have the look stage, step 1, and then the touch, which is the step 2. Step 1, you look. You stand in front of the mirror. It's advisable to do this after menstruation for people that are still menstruating. Okay. But for the menopausal women, people that have stopped, pick a date. You could decide every first of the month that you do your self-breast examination to make it constant. So you stand in front of the mirror with your hand by your side. Look at your breasts, the 2 of them. You first stand facing the mirror, then you stand on the right side, then you turn to the left side. That way you are able to see the whole sides of the breast. So you look. Check this thing. You know the normal. By the time you are doing it consistently, you know what your normal breast looks like. So that if there's any change in size bigger than what it was before, you note it. If there's any dimpling of the skin or orange peel architectural appearance, that's what we call peau d'orange. Okay. You note rash, you note it. So you stand in front with your hands by your side. After that, still standing, you bend forward with your hand over your head. Okay. And still check. Check for all what I've mentioned already. Okay. Check that in front, right side, left side. Okay. Then you now stand with your hands on your hips, hunched up, and check again. If you notice anything abnormal, please see your doctor. Then you lie down. That's the touch stage. Okay. So lying down, you put your hand, you cross, if you want to check the right breast,
Yes.
this is my right, you cross your left, the right leg over the right side.
Okay.
Then put your right hand on your forehead. Use the left hand, the 3 middle fingers, the pop of the hand, not the tip.
Okay.
And start with the armpits. Circular motion. Circular motion. And gradually move to the brow line. When you get to the brow line, you start from the up, move down. You are feeling it. Just be changing gradually until you get to the nipple. While doing this, you can put, so that you are not uncomfortable, you can put a pillow under your back.
Okay.
Back. So when you get to the nipple now, you turn and lie flat on your back.
Okay.
And then you now put your hand at right angle, like
Okay.
this. And then massage the nipple.
Yeah.
And then go towards the center, the same movement that you did on the other side.
Yeah.
Then you now do the same on the left-hand side. If you do this every month, you'll be able to detect anything abnormal that has happened. I know women are generally lazy. We're taking some time.
Well, could it be laziness, or it's still, you know, like the last our last episode, we were like, you know, for some men too, for some people, and for a number of us, and I think this area we can be quite superstitious about things. You just think that what I don't know will not kill me. Yes. Or because it's like, if I go searching, I may find. I don't want to find it. So if I'm not looking for it, it will not come to me.
It's not my portion.
It's not. Yes. Definitely, it is not our portion.
But I tell you that they say faith without works does not work. If you don't take action, it will become your portion.
Wow.
So you need to do that. And for the married people, husbands, if your wife doesn't check it for her. In fact, I always ask when they come for FNSC, I see one huge mass. I'm like, Oga, you brought your wife. Didn't you see when this thing started small? He will just laugh. It's okay, that's an indication of the intimacy between the couple. Because those that are really intimate, is the husband that we first, I noticed a mass in my wife's breast, which is good.
Yeah. Wow.
So that can be taken care of. So self-breast examination can help with early detection. So once you find a mass in there, or the change in the skin color, or the change in the skin size, I mean the breast size, rash, anything abnormal, please report. Don't just go for self-medication. Let them look at what is there. There are several tests that will be done to know what it is.
Okay. Wow. At this point, I want to ask you to please hit, smash, press, touch the subscribe button right there. And if you haven't done so, if you're just joining us on Safe Space with Pastor Wale, if you haven't done so, please share. I mean, I have for me, just listening to the doctor now telling us how to do this breast examination, I must confess, I've never had it or heard it this way. Honestly, I have not. If someone were to stop me on the road and say, do you know about self-breast examination? I would have said yes. And I'll just tell you, know what, stand in front of a mirror, put your hand behind your head, and just keep going around. Just check. You will find it. And if you find anything, go to the doctor. But today she has taken us through the steps. She has taken us through what to do. And one thing you have said is that the prevention is cheaper than the millions we spend in treatments. The other thing I'm also hearing truly is that we need to know our bodies. We need to know our bodies.
It's
because,
very important.
Yes, because like she said, if you do not know what your normal is, and everybody's normal is not the same, so if you don't know what your normal is, when there's an abnormal, you also would not know it. So, ma'am, can you tell us about the, you were like, if you find something, you go to the doctor, they do more tests, and, then they can confirm. So what other tests? Can you tell us you just take us through the journey, what happens with a typical, maybe if you go and you find something, maybe, oh, there's a lump, there's pain, and I go to see the doctor. What happens from there?
Okay. In brief, the doctor will general examination, consultation. So medical history. We'll find out if there's a family history of breast cancer, your age, if you fall into that group, and then your menstrual cycle, what menstrual cycle you are, and we'll now examine the breast to determine, it may have just been a rash that you notice, or discoloration of the skin. So we'll now do physical examination. And if there's a mass there, you may recommend a mammogram to see what kind of mass is there, or an ultrasound.
Okay.
So,
what determines which?
the surgeon will decide what he wants to do.
Okay.
He will decide which particular one he wants to do. And then he might decide to do a fine needle aspiration biopsy. That is, just put a needle there and take a little sample,
Okay.
smear it on a slide, stain it, and then we'll send it to us, the pathologist. We'll do this thing, look under the microscope, and say this is benign, this is malignant. This will help to know what kind of surgery to carry out on the patient. Because if it's the benign, you may just decide to remove the lump. If it's malignant, you will decide what else to do.
Okay.
To remove the breast, or go for chemotherapy first, or whatever. But it's from that tissue that we'll now do other specialized tests, like the immunohistochemistry, that will tell us what kind of drug the oncologist is going to administer to the patient. So it's very important that you report to the doctor once you notice any change in the breast. So he will now be the one to outline the treatment modalities for you.
Okay. Okay. Do you have patients? Because there was a statement you made there that just went, in my head, and I'm like, for some, for some women, it'll be like, would they tell me, would they cut off my breast and then I'm walking around with that? Because that may be
It is
that may be a
high.
reason why I've heard a story of somebody that was like, no. Unfortunately, I heard she passed on eventually, but that was really a concern for her. Do you
In my
encounter
practice,
people?
I've seen it's a big problem, especially in African countries, in our environment, in Nigeria. Yes, I know one of the treatments for breast cancer is a mastectomy, removing the breast.
Yeah.
Some people may do the other surgeries. But I always advise my patients, when you go, whatever your surgeon says he wants to do, please, is for your own safety, is to preserve your life. Do it. There are a lot of women on the street that have had their breasts removed and are wearing prosthetics. Nobody's going to leave you with a flat chest. One has been removed. There are provisions that have been made, for it, not to balance up. Yeah. Prosthetics have been developed that have been put in place. We know a popular Hollywood actress, Angelina Jolie.
Yes. Yeah.
She has a family history of breast cancer, ovarian cancer. Her grandmother, her mother, I think an auntie, all had cancers, either the breast or the ovarian cancer. She went and checked for the gene BRCA1 and 2, and it was positive. She didn't wait to see whether she will develop cancer of the breast or any of the cancers. She removed her 2 breasts. And now Alen, she has removed her ovaries too. Because she wants to live for her children. But when you see her, you will not know that she doesn't have breasts. She has breasts there. Wow. So please, if you are diagnosed with cancer, I've had so many that they will come up and you tell them, okay, this is this. I had one incident that I just told her, go and see your doctor. Please, whatever he tells you to do, do it. So no, I'm going to drink. I don't want to mention the drink. I'm going to drink this. It will cure it. It will cure it. I kept quiet. The next thing, I heard her obituary on the radio.
Oh, wow.
After about a year. Yes. By the time she realizes that she needed help, it was inoperable. You know, the cancer can grow so much that you can't even operate it again.
Wow.
Please, women, don't let it get to that level.
Wow.
Her whole aim is for you to survive.
Yes.
You have people that look up to you. You have your time to spend on earth. Don't let anybody cut it short for you. And don't follow, advice from people. Talk to people. Don't do this, don't do that. Please, trust your doctor. We mean well for you.
Thank you very much. Thank you very, very much. In fact, which for me still reiterates the fact that your normal is not somebody else's normal.
Exactly.
Your journey is not somebody else's journey. So whatever it is, like she has said, please go and see a doctor. It's better you go and you're told no cause for alarm, right? You are told no cause for alarm than you stay at home and you're probably just sitting on a time bomb waiting to go off. So now, Dr. Mobong, there's been a lot of awareness, as in, I know this year, funny enough, it's not, the buzz hasn't really been as much as past years, maybe because of the pandemic, but I would think that with all that's been, the awareness, the month, do people still come in? Do you think the awareness has increased? Do you especially in our environment? Do you think the awareness has increased? One would think that the incidence of breast cancer or death should be reducing with all, is it? I'm just curious about that.
I would say in the urban areas that the awareness has increased. In the urban areas, but in the rural areas, I wouldn't know so much about it. The awareness has increased. There are a lot of NGOs that are working, to create awareness about the different types of cancers. This year, like you said, I guess it's the pandemic that has affected everything. Because this period now, even in camps, when during NYC camp, Medical Women Association of Nigeria, FCT chapter, we go there to create awareness, cancer, and actually even screen them.
Wow.
Screen them in some of the incidents. But this year there hasn't been any camp since March. Since March, so that cannot even be done. So some NGOs actually even go to churches, mosques, to create that awareness. But it's one thing for you to create awareness, another thing for people to take action. There are two different things. But the cancer that I know has reduced because of awareness is cervical cancer. We are not seeing them like we used to see them before. Rather, it's the breast cancer that's really increased.
Wow.
Because I guess for cervical, if I can come in here, cervical cancer, there's more women are doing pap smear, that are aware of pap smear. That are doing it. More NGOs are given that opportunity for people to do pap smears. And I've had the opportunities to screen women from churches. Invite, okay, we are having a women program. Please, can you come and do pap smear for our women?
Wow,
that's
fantastic.
The church sponsors, and the women don't have to pay anything. That has been done a lot with, within Abuja here. Nigerians like free things.
Well, yes.
So, but what I always say, you don't appreciate what you don't pay for. You don't appreciate.
You don't put value on it.
Don't value it. So if you put value on your health, I know it's expensive, a bit expensive to do some of these tests, pap smears, mammogram, and things. But if you value your health, you save something aside. I always advise people, do comprehensive medical checkup once in a year. have an account that you don't touch, no matter how pressing it is. Even if it's 1,000, 2,000 that you put in there, at the end of the year or the beginning of the year, you bring it out. Do the basic things that you need to do. Mammogram is one of them. Once you clock 40, do a regular yearly mammogram, or at least 2 years.
Okay.
At least 2 years, but yearly if you have the resources. Then do a pap smear. Those regular screenings it goes a long way to prevent the cancer, or at least to diagnose early.
Okay. How about a breast ultrasound?
Ultrasound is not really part of the screening. It's request from the physician.
Okay.
So,
okay,
but you can also walk in and say you want to have your ultrasound done on the breast. Okay. But the main screening is for breast is the mammogram.
Okay. And that can be done yearly?
Can be done yearly or every 2 years.
Or every 2 years.
Once you reach 40 years of age.
Okay. But it's nice to know that the self-breast examination, there's no date limits. You don't have to book an appointment. You just have to book an appointment with yourself.
It's yourself in front of your mirror inside your room.
And your mirror.
Mind you, self-breast examination, you are standing naked. You're not wearing cloth.
Yes.
Of course, you understand, so that don't wear cloth and stand in front of men, be looking at the breast that is inside the bra.
As it bears repeating, it bears explaining, because for me it's good to know what to do and to do it well.
Well, yes.
And to do it well. Okay, so when you talk about the tests, the other tests, because I'm still going there, I'm still going to talk about the issue of costs. And I know you've touched it. About investing in ourselves. I mean, putting value on our health, putting value on our lives, as it were. You've touched on that. But I'm thinking of like when we were reading up and researching for this program, and I'm trying to find out, okay, how much does this cost? And I was surprised to find the cost of the test can be a little pricey, and I'm wondering why. Because unfortunately, maybe because of where we are too, it may not be. Yes, there's the factor that we don't always really value our health, but sometimes people have this thing of, they just make things unnecessarily expensive. And like I had said before the end of this program, we will share some places you can actually go to for tests, because there are some places now that are actually even doing discounts on this test because of the Breast Cancer Awareness Month. That is their own contribution, just like this is our own contribution to getting this awareness out there. So why are these tests expensive? People need to understand what's going on, so they don't just feel like, why are they doing this to me? And also so that people who can afford to be of help to those who may not be able to afford it can understand that this is something you can invest into to save somebody's life.
The tests are they really expensive?
Well,
I think if you value your health, your life,
4,000
shouldn't be.
And that's in a general hospital.
That's a general hospital. That is where you have the cheapest rates.
Yeah.
Rates, 4,000. The cost of the reagents are really expensive, especially now this year with this pandemic. Getting those things available. We don't produce anything in Nigeria.
Okay.
So everything is imported. And it's almost a Herculean task to bring in some of these things.
Yeah.
So it's not about profit making now.
Okay.
It's about getting the people, ensuring that you are healthy.
Okay, that was the point. That's what I wanted to hear, and I wanted us, the audience, to also hear that it is not about profit making. Like there are Medicaid right now. They're doing
Cancer Foundation.
Yes, Cancer Foundation. The Cancer Foundation is they are sponsoring. I think between the 1st and 31st of October, they're doing 50% discounts.
Yeah.
Yes, 50% discounts on a
Mam
number of these tests on mammogram,
mammogram,
pap
pap
smear,
smear,
the
ultrasound, PSA
breast
for the
ultrasound.
men.
So please take advantage. The address and the number, the contact number will be scrolling at the bottom of the screen. Limi Hospital also, I'm aware they're also doing, I think 30% off now, the package because for the breast cancer awareness month. So please take advantage of it. Men are also not left out. Men are also not left out. There are tests for men. So you can call these numbers. And like she said, doctor has said that a number of these things are appearing more and more in young people
Now
than,
we have cancer of the children.
as in
Children.
children.
There are some cancers that are just children, you know.
Wow.
You have 1 year old, 2 years, 3 years coming down with
Wow.
cancer.
So it's something. It's not. We shouldn't just rule out anything. I always say it is best to go to the experts. God gave doctors wisdom. It's better to go. Don't keep quiet about anything you observe. Go there and let them tell you nothing is wrong. Get an understanding of what is happening in your body. It is the only body you have. And go to the, if you say it's too, if you're afraid of going to the private clinics or the private hospitals, and go to the general hospitals. For me, just make inquiries and ask questions. You can go to all the general hospitals in this city. You can go to them, ask questions. They can send you to their lab, send you to their x-rays for the appropriate test, and you get them done. Now, if you're just joining in, we're almost wrapping up. And thankfully, you can still listen to the program from the beginning. You have missed a lot. You have missed a lot. But we'll be wrapping up shortly. Just take your time and listen. This is one episode that I think you need to take time and listen to again and again, especially if you're female or you are a male who has a female you care about. So
let me just put in something.
Yes.
You know, I mentioned tobacco as a very common cause of cancer.
Yes.
It's not just the people that smoke.
Uh-huh.
Passive smokers. What do you mean by passive smokers? If you are consistently in the company of people that smoke, you're a passive smoker. Because that smoke, you are inhaling it too.
Wow.
So it also affects you. Wow. So it's not just for smokers and non-smokers. We call them passive smokers. So you have to avoid that. Then alcohol too. Forgot to mention that. Alcohol consumption predisposes to cancer.
Wow.
So if you've been taking so much of alcohol, you need to limit it. The quantity that you take. And if possible, stop it entirely. And then tobacco, please, you need to stop. If you're in the company of people, advise them. If they refuse, stay clear of such company because you're a passive smoker. What applies to them also applies to you. Even though they have a higher risk, you still have a risk.
Wow. Thank you so very much. Thank you. I know that's not your final word, and I'm still coming back. For those of you who've been with us from the beginning, I am grateful. I thank you for your questions. And I'm sure they've been attended to. And if you still have questions, even when the program is over, if you have questions, you want to know how you can be of help, Limi Hospital has graciously given safe space, 2 slots for 2 indigent women that may not be able to afford their own scans. Some of you looking at me right now, you can afford it. You can afford it. You can afford to walk into, yes, you can afford to go to Asokoro General Hospital. You can afford to go to Garki. You can, I'm in Abuja, so I'm mentioning places here in Abuja.
Yes.
You can afford to go to Medicaid. Medicaid, don't, you can afford to walk into Limi Hospital. You know, sometimes we just, once you just say, oh, money, you use money you zone yourself out of many things with money as an excuse. Money is meant to serve you. Money is not meant to exclude you. Like she said, don't shorten your life when you can do something about it. And if you have that money and you want to be of help to people, you want to be of help, if you're listening to me now, you can talk to your imam, you can talk to your pastor, you may want to be able to organize women, bring them together, and it doesn't have to be completely free, so that the women also learn to put value on their health and on their
like
lives.
I said, there's some
Yes.
churches, societies. There's a church that the men fellowship actually organized
For the women.
For the women, yeah.
For the women.
Yeah.
For men who love their women.
And we actually we went to the church to take the smells there. It was a pap smear, cervical screening.
Wow.
So it could be done. Women Association could organize.
Wow.
Do it for the younger girls.
Wow. Fantastic. We're closing now. We're closing now. And we could stay on this topic for a long time, but we do have to shut down. And I just want Dr. Emma to just give us 2 minutes, just in 2 minutes, say something to the audience.
Okay, we talked about the pink, a touch of pink, you know, this month representing cancer of the breast. It actually represents the fear of the disease, hope for the future, support for the people and businesses that cater for these categories of people that have cancer, and then also identify with people living with cancer. So that's the whole essence of the touch of the pink. Identification gives hope for the future, that it's not a death sentence, like we've already said. Now, cancer again. Cancer can be prevented. All we need to do is change our lifestyle. Change all the risk factors that we have enumerated here. And then, please, no self-treatment. If you find anything abnormal, go to the hospital. Get it properly checked out. At times, we spend more money when we go round and round. Because some people may notice the mass, and they walk to a pharmacy, notice a mass, give me drug, antibiotic, it reduces, you've spent money there. By the time they eventually come to the hospital, the money is finished. Please, for cases like this, go to the hospital straight. Do whatever they ask you to do. Self-breast examination, I will mention it again. It has saved lives. It can be detected early. Cancer is treatable. The prognosis is better when it is detected early. So early diagnosis is very, very important for cancer, any type of cancer at all. Apart from the breast, there are other tumor markers that can be used. Like cancer of the ovary, there's a tumor marker that can be used. That's why when you go for a comprehensive medical examination, the doctor will be able to enumerate all the basic things that you need to test. I don't think any amount is too much for you to stay alive.
For your health, for your life. For your life. Thank you, Dr. Mobo. If we leave Dr. Oshobi, she's very passionate about this. And I want to encourage all of you to just to stay tuned to the next episode of Safe Space. We will talk more on some other issues that affect us, that affect the women folk, and she will be here to elaborate more. And by the grace of God, you will also hear testimonies from people who have been on this journey, and that will encourage you to know, like she has said, that it is not a death sentence. It is not. There is life beyond
cancer.
This. There is life beyond cancer. It is not a death sentence. Thank you so very much for tuning in today. We are so grateful. Thank you for sharing. Thank you for subscribing. Thank you for playing your part in taking this program round and increasing awareness. Thank you so much. Looking forward to you're joining us on the next episode of Safe Space with Pastor Wale. Have a pleasant afternoon and enjoy the rest of your day. Thank you.